Good evening, and welcome to June's edition of the Ask Mary and Pat Show, featuring Miss Mary Finner and Miss Pat Bogan. We are so glad that you're joining us this evening from wherever you may be, and to the ones who will be joining us later on. Thanks for tuning in. My name is Miss. My name is Sharonda Lee. I'm a navigator and a technology assistant for Oak Hill Regional Community Development Corporation, which is the parent corporation of Healthy Kids Mississippi. We recognize our board chair, Jennifer Garrett, our executive director, Dr. Michael O. Minor, and our project director, Mrs. Lottie Minor. In addition to this Zoom cast, we are restreaming this evening's webinar on our Oak Hill Regional CDC and Healthy Kids Mississippi Facebook pages. Feel free to like and share on your social media pages. Also, post any questions or comments in the Zoom chat or in the social media comments. We will do our best to respond to each and every question. Before we get started, here are a few reminders. If you haven't downloaded the Oak Hill Regional CDC app, please take a moment to do so. It is free of charge in the Google Play Store as well as the Apple App Store. All you have to do is search Oak Hill Regional CDC or Mississippi Healthcare Help. Did I say that it's free? Yes, free of charge. Yes, you heard it correctly. Go download it now. We are excited. We are so excited tonight to be able to share some beneficial information to everyone. That's exciting news to us. Our next Thursday, Wednesday parent resource chat will be on July 17th. The next Act Mary and Pat show will be July. No, sorry. It will be June 29th. July 29th at 6 o'clock. I'm going to get it right. We will remind you again at the conclusion of this show. Now it is time to get the show started. All right, Miss Mary Finner and Miss Pat Boga, it's in your hands.
Okay, thank you, Miss Lee. What a great introduction. Hi, my name is Mary Finner, and I'm a navigator and a application assistant with Oak Hill Regional Community Development Corporation. Tonight is going to be myself, Mary Finner, and also Ms. Dorita Knox that will be with me tonight. Ms. Pat won't be with us on tonight, but she will be with us hopefully on the next time. So we want to get started with the questions. And the first question that I have is, what benefit is it for me to have a Medicaid assistant complete a Medicaid application? Well, one of the benefits is that you may not be able to get to your Medicaid office, especially if you work. And when you get off work, the Medicaid offices are closed. Then you can call us and we can assist you with applying for Medicaid for yourself or for your children. That's one of the benefits. We can do the application online. We're available 7 days a week if necessary. Okay, Ms. Knox, do you have a question in front of you?
Yes, ma'am. My question is, my son turned 18 last month, and I lost my Medicaid. He also lost his as well. Why did I lose mine? Once your child turns 18, he is no longer eligible. Therefore, you are no longer eligible. If at that time you have no income, you need to go to one of the community health centers and for services that can be provided. But once your child turns the age of 18, he is removed and you are automatically removed. So you need to, if you have no income, be sure to go to a community health center to apply for services. And it's on a sliding scale. Services are rendered on a sliding scale measure. So you most likely you will be eligible for services if you would go to those.
And if you need to know the locations of those health centers, we have where you can give us a call and we can find one in your area. And also, a child is eligible up until the age of 19. But once the child turned 18, the parent is no longer eligible if there are no other children in the household under the age of 18. They only can get in until if a child is under the age of 18. But once the child is still eligible, even if the parent comes off, once they turn 18, the child is still eligible until they turn 19. That's when they come off. Okay, so the next question I have, I was approved for Medicaid for my children, but my sister was approved for CHIP for her children. I would much rather have CHIP for my children because it covers more services and she is able to receive orthodontist services for her son who needs braces. Why can't I get CHIP? Well, the answer is Medicaid and CHIP is based on income and the number of people in your household. So if you if you're over the income for the if you are over the income limit for regular Medicaid, then the child will automatically go on CHIP. But the only way you'll be eligible for CHIP is really based on income and the size of your household. You can't choose which program you want to get on. You can't choose if you want to be on Medicaid, if you want to be on CHIP. It's completely done with if you income eligibility and household size. Okay, Ms. Knox, do you have a question?
All right. I have another son living in my household that is 27 years old, unemployed, but it has custody of his 1-year-old daughter. He is able to keep his Medicaid. Why wasn't I able to keep my Medicaid? They both live in my household. And the reason why you're not able to keep your Medicaid is because he has custody of the child. Once he's in your household and he has custody of the child, he is the one that has to apply for that child. Because maybe you are a grandparent and you are no longer eligible in the Medicaid budget. But again, I can tell you, you can also again go to Federal Qualified Community Health Center and get all the services basically you need.
That's true. If you don't have a child in the household under the age of 18, and if your grandchild is in there, but the grandchild's parent is in the household, then that's who would get the Medicaid, would be the parent. Now, if the child's parent wasn't in the household and you had custody, or even if the child was just living with you and you didn't really have parental custody, you would be eligible for Medicaid as long as you can show relationship.
Right.
Okay.
And if the child is in your household and you still do not want to be in the budget, for instance, you get Social Security, the child could get Medicaid and you can be left out of the budget. Your income will not be counted in the budget.
Right, your income is not counted for a grandchild or someone other than your child.
Right.
Okay. I am an immigrant and I need to apply for Medicaid for my children. I just moved to the United States about a year ago, and I do not have the proper documents to get Medicaid for myself. But my child was born 2 months ago in the United States. Can I apply for Medicaid for her? Yes, you can apply for Medicaid for your child because your child is a United States citizen. You will have to have a birth certificate and also a social security number. And if for some instance or reason, for any reason that you do not have the social security card at the time, you can always let them know that you haven't received it. Then your child will still get the Medicaid and they will give you some time to turn the social security number in. But once the child turns a year, and if they're still eligible for Medicaid, you would have to produce that Social Security card or the Social Security number. So yes, your child is eligible because your child was born in the United States. Do you have another one, Ms. Knox?
Ms. Fenner, if you would read the third question, I can't see it on
Okay.
my
Let,
phone.
okay, let me see if I can pull it up. Hold on 1 second. Well, maybe we can go to a commercial right now
I come back. Yes.
and come back to it.
All right. Thank you.
Hey, fellow Mississippians. Get Covered Mississippi is so proud to have helped so many of you during the 2024 open enrollment season. 286,410 Mississippians were able to obtain coverage through the Affordable Care Act marketplace. That is a 56% increase from open enrollment 2023. Congratulations to you for getting coverage that you need, but our job is not done. We want to increase that overall number during this special enrollment period. We have over 60 plus certified navigators located in or near all 82 counties in Mississippi that are ready, willing, and able to assist you. Get Covered Mississippi is not just an organization. It's a movement that has transformed lives and communities. Through its faith-based coalition, it has raised public awareness about health coverage options available through the Affordable Care Act Medicaid, CHIP, Medicare, and our federally qualified community health centers. The dream of a healthier Mississippi has driven us for over a decade. Listen to our certified navigators and they will explain why you should enroll.
Miss Fenner, I have a question that
Sure. Mm-hmm.
I have a question that a client asked me, and she wanted to know, she had recently gotten married and it was time for her renewal. And they asked for the step parent income. And she wanted to know, why was her Medicaid cut off for the child that was not his child? It was step parent income. The new ruling is that they include step parent income now. If you turn in your step parent income, well, you do have to turn it in. And it goes over the income limit, then that child or those children are not eligible. They're no longer eligible because they are step parent. The income is counted. Step parent income is counted.
And if it's over the income limit, then the child will no longer be eligible for Medicaid. And that is a new
Medicaid,
rule,
right?
right? One time,
Yeah, it's a new rule.
right, the step parent's income was not counted, but now the step parent's income is counted. So, and if it's over the income limit, then the child would no longer be eligible for Medicaid or CHIP if it's over the income limit for CHIP as well.
Right.
And I think this question probably, but I might ask it anyway. I just recently lost Medicaid because I started working full time. I have 3 minor children under the age of 6 that still receive Medicaid. I'm only earning $1,000 per month and can barely live off that. I still take medications on a regular basis. And what am I supposed to do now? Well, with that $1,000 a month and you have a household of 4, you probably won't be eligible for insurance through the Affordable Care Act because your income may be too low. So what we do in that case, we refer you to the federally qualified health center that will be able to assist you with your medication, with you seeing a doctor, and it's on a sliding scale. I can't say that you pay according to your income, but it's on a sliding scale. It's based on your income, but it's a sliding scale. And that's so. And if you need information on one in your area, you can give us a call and we can refer you to one of our assistants who's familiar with and work with the federally qualified health center can let you know where one is located in your area. Okay. The next question is, I don't have time to complete a Medicaid application for my children because I work 12 hours a day and 5 days a week. I'm off work on Saturdays, but as you know, the Medicaid offices are not open on Saturdays. So how can I apply? What you can do is give us a call at 662-298-3584, and one of our assistants will help you with applying for Medicaid for your children online. And also, if you like, you can also go online and do it yourself. But some of the questions might be a little tricky. And that's why we offer our assistance, because we're familiar with the questions online, and then we can assist you with applying for Medicaid for your children with your consent and you being on the phone as well. And you can call our office and we can assist you with applying for Medicaid. We can put the application in, as I was saying earlier, 7 days a week. We're available to help. Someone will be available to help you with putting in an application for Medicaid for your children. And then I have another question where recently I applied for Medicaid for my child and was denied because I did not turn in my check stub for the month that was requested. I now have those check stubs. And am I able to drop them off and reapply for Medicaid? Depending on the date of your application, if it's in with a certain time, you would not have to do another application. You can just submit the check stub. Check with your Medicaid office or your Medicaid person and see if you can just submit the check stubs. It might be just a matter of you doing that. But if it's over a certain length of time, you can apply for Medicaid at any time. You can get denied one day and reapply the next day. There's no limit or the waiting period for applying for Medicaid. So you can just submit your check stubs. Most of the time, that's all that's needed if it hasn't been 2 or 3 months. Now, if it's been longer than a couple of months, those check stubs may not be what they need. They usually need the prior month's check stub. So if it's in within a month's time and you have those prior month's check stubs, then you can submit those check stubs. But if it's been a while since you were denied, you do have to put in another application and submit the check stub for the prior month. But you can reapply at any time. Okay. I do have one more question. There might be some other questions that's online but my son is 21 and needs health insurance. He is in college and he plays basketball and football. He needs coverage because of the risk of being injured while playing those sports. I was told by Medicaid that he's no longer can receive Medicaid because he's over the age limit of 19. What do I do now? Well, one choice you have is to apply for health insurance through the Affordable Care Act. If he has an income, and I was just told that some of the Pell Grant can be used toward his income for the Affordable Care Act. Or if you're still claiming him on your insurance, you can apply for him to get insurance through the Affordable Care Act with your income. It depends on your situation. But you have to have him on your income taxes for the following year in order for you to apply for him to see if he's eligible or you're eligible for a tax credit. But I see that Mr. Campbell is on with us. Mr. Campbell, do you have any other things to add to about the Affordable Care Act?
Okay, if I was going to add anything about the Affordable Care Act, I would say that make sure that folks realize that there's what's called a 150% special enrollment period, which means that if your income is less than 150% of the federal poverty level for your family size, you're eligible for a special enrollment period right now, and you can apply, let's say, today and start coverage on the 1st of July. So if you're sitting out there uninsured, contact a navigator and we'll check your income and see if maybe you qualify for the special enrollment period, and then you can get yourself covered, you and your family covered. And that'd be about it.
Okay.
I have a question for Mr. Campbell. Concerning Mr. Campbell,
Yes.
concerning veterans, someone that has been recently approved for disability through the VA, but it's what kind of special enrollment period do they have? You know, recently approved for VA disability, like a 80%.
Mm-hmm.
Now they're ready to apply for the ACA. They didn't apply previously because they had no income.
Okay. Veterans disability payments are not considered eligible income for the ACA. So they still would not be able to apply for ACA coverage. They'd have to use the VA provided medical coverage.
All right. All right.
Which is,
Thank you, Mr. Campbell.
okay, it's probably free and a better deal for them anyway.
All right. Well, they wanted the ACA and VA benefit.
Okay. Yeah, unfortunately, if they don't have standalone income that qualifies them before they receive the disability income, they're still not eligible. It's kind of like a double, it'd be considered double dipping. You're getting government benefits through the VA because if you're getting the VA benefits, then you disability benefits, then you automatically qualify for probably tier 1 coverage, at least tier 1 and tier 2 group coverage with the VA. And so that's what you're expected to use.
All right.
Okay. Sorry.
Okay. Thank you.
You're welcome.
Okay, Mr. Campbell, can you tell us what the 10 benefits coverage that the ACA provides?
Yes, I can. Give me just a couple seconds to pull them up to make sure that I read them correctly.
Okay.
Okay, the 10 essential benefits that marketplace health insurance plans cover are ambulatory patient services, which is outpatient care you get without being admitted to a hospital, emergency services at the emergency room, hospitalization for surgeries and overnight stays, pregnancy, maternity, and newborn care, both before and after the birth of the child, mental health and substance use disorder services, including behavioral health treatment. This includes counseling and psychotherapy. It covers prescription drugs. It covers rehabilitative and habilitative services and devices to help people with injuries, disabilities, or chronic conditions to gain or recover mental and physical skills. Laboratory services, preventive and wellness services, and chronic disease management, and pediatric services, including oral and vision care. But adult dental and vision coverage aren't considered essential health benefits. But if you do get a plan from the ACA, most of the time you'll be able to get a supplemental dental plan, and then some of the insurance providers will also have dental and vision coverage that you can get right along with the medical plan that you get with them.
Okay, and those 10 essential benefits are also covered under Medicaid as well.
That's
So-
correct. And actually, any qualified health plan is supposed to cover these 10 essential benefits. And so that'd be any government-sponsored coverage, such as, well, Medicare, Medicaid, TRICARE, and what Sister Knox was talking about, the Veterans Administration coverage covers the 10 essential benefits as well.
Right. So are there any more questions that we have? Or can we do another commercial at this time?
CHIP has established itself as a critical piece of the federal state response to children's health care needs. CHIP, signed into law on August 5, 1997 by former President Bill Clinton, was created to build on the success of Medicaid by giving states the opportunity to receive enhanced federal matching funds to expand affordable health coverage to children and families that earn too much to qualify for Medicaid but too little to afford private health insurance. Over the past 25 years, CHIP and Medicaid have sharply reduced the rate of uninsured children in the U.S. Together, they have successfully kept children connected to health coverage and played an important role during recent economic downturns and public health emergencies in the state of Mississippi. The Children's Health Insurance Program provides insurance coverage for uninsured children up to age 19 whose family's income does not exceed 209% of federal poverty level. Families may earn up to 209% of the federal poverty level and be eligible for CHIP. A child must be determined ineligible for Medicaid before eligibility for CHIP can be considered. Children with current health insurance coverage at the time of application are not eligible for CHIP. Our organization, Oak Hill Regional Community Development Corporation, is focused on raising public awareness about health coverage options for children and their parents through our Healthy Kids Mississippi initiative. To learn more about our organization, visit us on our website, healthykidsms.org. Give us a call at 662-298-3584 or text us at 662-689-9712. We are always ready to assist.
Okay, that's some excellent information. So you can always give us a call at 662-298-3584 if you have any further questions about health insurance, the federally qualified health centers, Medicaid, the Affordable Care Act, and someone will be there to assist you during our office hours. That's all I have for right now. Do we have any questions that came through on social media? Okay, we didn't have any questions that came through on social media. So Miss Sharonda Lee, and if don't nobody else have any more questions, it's back in your hands.
Okay, thank you, Miss Mary Thinner. Those were some great questions, great answers. Once again, you can reach us at any time, 662-298-3584. If you have any burning questions, we are more than willing and ready to assist you. And I do want to back up a minute. I have some corrections. Next month, we will not have our third Wednesday parent resource chat. We will resume on August the 21st at 11 o'clock a.m. So please tune in on August the 21st at 11 o'clock a.m. and invite somebody along. We have some great information, great speaker that is ready to share with us. So please invite somebody and tell somebody else about us. And we'll have our next Mary and Pat show on July 29th at 6 o'clock p.m. You may learn more about us at www.oakhillregionalcdc.com and www.healthykidsmississippi.org. Again, you can contact us at 662-298-3584 or text us at 662-689-9712. Once again, we acknowledge our board chair, Ms. Jennifer Garrett, our executive director, Dr. Michael O. Minor, and our project director, Mrs. Lottie Minor. This has been a production of Oak Hill Regional Community Development Corporation, belonging, building, and bridging in the Mid-South region and across the beautiful state of Mississippi. Good night.